I'm Charles Lee with the Richmond City Health District, and we're here with a live video with Dr. Shantelle Brown from the New Hope Pharmacy that's coming to Church Hill. And we are proud to have you with us today.
Thank you for having me.
Yeah. And today we're going to talk about nicotine replacement therapy. And did you know that 3/4 of Virginia tobacco users are interested in quitting? And when someone tells us they want to quit smoking or stop using tobacco products, we encourage them to call 1-800-QUIT-NOW to put together a personalized plan and to get help in quitting smoking. And we also want you to talk to your healthcare provider or your pharmacist about nicotine replacement therapy. And Dr. Shantelle Brown is going to talk to us about that and what all that means and some very good information for us. Now, first of all, I want to talk about vaping and e-cigarettes. Everybody's using it now. What are your thoughts?
My thoughts are that it's still dangerous. Whether it's in the form of a liquid, which is what the vapors are, or in the form of tobacco, it's still very dangerous and hazardous to our health. And so when we look at the numbers of disease that affects the Americans here, there are about 16 million Americans who are affected by or have some type of smoking-related disease, whether it's heart disease, lung disease, or various cancers. And so those numbers should not be surprising, because when you smoke, whether you vape or whether you smoke tobacco, it affects almost every organ in the body. Okay. And so that's why those numbers are so large.
Okay, interesting. Now, what are nicotine replacement therapies?
So developers have come up with a way to incorporate tiny amounts of nicotine, nicotine being the number one addictive ingredient in all of the tobacco products. They take small amounts to help reduce the cravings. And so it's released at different times, whether it's through the gum, patch, lozenge, the inhaler, as well as the nasal spray. The nicotine is released at different times through the usage to help combat to help with the cravings that one may experience.
Okay. Oh, good. Now, which one of those need prescriptions?
So there are a total of 7 actual smoking cessation products. 4 of them require prescriptions. The tablets, which are Chantix, the tablets, which are Wellbutrin, also known as bupropion, and the inhaler, nicotine inhaler, as well as nicotine nasal spray. Okay. Those 4 require prescriptions.
Okay. Now, I may know a couple of people who've tried to use a few of them at the same time, maybe like the gum and the patch or something else at the same time. Is that a good idea? And can you use more than one at the same time?
Studies have not indicated that using these, even along with smoking, has been dangerous. But in my experience, I've seen probably the tablets and maybe a patch used. I wouldn't recommend using both. I would do one therapy at a time. But there has not seemed to be any dangerous effects that have come about because of it.
Oh, okay. And what about insurance? How can you find out if the cessation tool you're interested in using is covered by your insurance?
Okay. So when we look at the state of Virginia, it is preferred through Medicaid, which is great. And so I think when the Affordable Health Care Act came about, it was a preventative measure. And so with that, there are a lot of the cessation tools that are covered. For Medicaid, all of them are covered. Some of them may require prior authorization, but the pharmacists and doctors will work together to get that approved for you. But then commercial insurances, they may have specific ones they'll cover. And so I would contact my insurance company, find out which smoking cessation agent is preferred, so that you're paying the least amount of money.
Okay. And I think earlier, going back, you mentioned there were, 5
nicotine replacement
therapists. So
and,
what are they?
And so you have the gum, nicotine gum, nicotine lozenges. You have nicotine patches. You have an inhaler as well as a nasal spray.
Okay. Now, are there any side effects with those?
They are. They range. We see nausea. We see irritation in the skin area from the patch, irritation in the throat, especially with the lozenger, which is absorbed through the mucous membrane. You have some insomnia.
Okay.
Those are some of the major ones with the nicotine replacement therapy. But with the tablets, the medication, the actual side effect profile is a lot greater.
Okay.
And so, especially with Chantix. Chantix, if you suffer from mental illness, from hallucinations, including hallucinations, if you have seizures, those are a couple of things that are heavy on the profile. And so if you have those things, I would stay away from that therapy because it'll only intensify it.
Yeah, sure. All right. Well, you're giving us some great information. Tell us a little bit about your new pharmacy.
Well, Hope Pharmacy is coming to Churchill this December.
Okay.
It's for me, it's coming back to where my first career job started, 2 blocks away. And so we're coming back into the community. The community wanted a pharmacy and they wanted fresh seafood. And so I'm able to help with one, not the other.
Not the seafood part,
but the store, the leadership, they have really taken the needs and wants of the community serious. And so they're doing everything to provide the things that the actual community wants. And so I'll be there to do my job.
And that's in December of this year.
December this year, 2018.
And what would be the address?
1330 North 25th Street.
1330
Right
North
in Churchill.
25th Street in Churchill. All right. And I guess they can, for right now, they can reach you via the website. But
you can go in through the website, which is the Market at 25th, and there's a link for Hope Pharmacy. And then I can be reached. I think there's information there, or you can call or email me, slbrown 0715@gmail.com.
Okay.
And so any questions you may have, I'm available.
All right. Well, good. Well, we appreciate you coming out and joining us this
Thank
afternoon.
you for having me.
Yeah, absolutely. And don't forget to call 1-800-QUIT-NOW for some free resources and support in quitting smoking. This is Charles Lee with Dr. Shantelle Brown. I'll see you next time. Thank you.
Thank you.